So, very good evening, friends. Meeting again in the session of Materia Medica. And today we're going to learn one of the important remedy from third year syllabus, that is Terebinth. Terebinth is the remedy which is prepared from oil of turpentine and very important in pathological cases. Generally, miasmatic background, if you will go through the remedy, you will understand it is between the psychosyphilitic, the cancerous miasm or tubercular miasm is strongly present over there in Terebinth. So it's a deep acting remedy which we have to learn. There are two cases. One is very recent and one is very old. First, I will share the old case that was because it was very thoroughly cured with the help of this remedy. A young fellow, nearly about 30 years of age, just married 3 years back, came with a diagnosis of medical renal disease or labeled as a chronic kidney disease. And he was diagnosed 6 months back. He was under the allopathic treatment. They have done everything. They have done the biopsy. They have done renal biopsy. They have done the USG, then the all urine routine, everything. And there is a tremendous increase in his creatinine. It was nearly about 3.4 or 3.5 at that time. And he had in urine 4 plus protein. So he was having puffiness of the face. Then he was under the steroids, and steroids since long time they were going on since starting of the treatment, and he was on in a reducing phase. It was brought down to the 10 milligram per day prednisolone. But after the span of 6 months, he started getting the symptoms again when the dose was reduced from uh, 20 milligram of prednisolone to 10 milligram of prednisolone. They immediately started the original symptoms. That is, he started getting very severe pain in urethra and lower abdomen. Then there is a very severe strangury, and whenever he used to pass the urine is blood urine with a thickened urine. And then, as there was no relief from the urologist and nephrologist, then he came for the homeopathic treatment. This fellow, 30 years fellow, was the by his occupation, he was a painter and working under the some manager and doing the regular painting works of the houses. And he started getting all of a sudden the burning micturition 6 months back. Then he started getting passing the blood in the urine. Urine was turbid, and which contains little bit coagulated things in the urine. And there was a pain, and then he was taken to the nephrologist. First to the physician referred to the nephrologist, and then the whole story started. The basic complaint was that he had a typhoid fever prior to it. 2 months before that, he got the typhoid fever, and when he was admitted in the hospital, and he was labeled that he was having a typhoid plus viral complex. He had a admitted for 4 5 days. He was continuously on IV fluids, IV injections, antibiotics, all those things, and he developed a rash at the end when he was discharged from the hospital. And after nearly about 1.5 to 2 months after that, he started getting these symptoms. So that was one important history which was there in the case. Second important thing which was there in the case was the burning micturition and hematuria. And urine was quite thick. It contains as if some cells were there. And that was second important thing. And it was very painful to pass the urine for him. That was second important feature. We used to get, this is what is called as strangury. When patient passes urine, it is very painful, goes into spasm, and passes urine in less quantity along with thick urine, hematuria, all. So that is a strangury. So which is again a characteristic of the Terebinth. Post typhoid, post scarlet fever, after the diphtheria, if cystitis happens, the inflammation of bladder happens. If there are nephrotic complaints or renal complaints, the Terebinth is one of the important remedy to be considered. And then I asked, where do you stay? He says that I just stay over there near the Sai temple in Sangamner, which is just near the river over there. And then I asked, just for the sake that, how is your house? He says, it's very old. We used to stay 3 people inside the house, and it's just nearby the temple and river. So there, as it is nearby river, near the temple, there is a moist area, the damp dwellings. Again, cystitis, which happens in damp dwellers or who resides in damp houses, Terebinth is again one of the important remedy. And this remedy has been depacting. I used to use it in 1 or 2 doses. Thereafter, I used to keep him patient always on watch. So I have started him directly on the Terebinth. Terebinth 33 doses were given and just kept on placebo, and I asked him to meet me after 15 days. After 10 days, he was returned. His all urinary complaints were settled, urine was clear, everything. But he said that I have started getting the rash on the body. And that's why he came on 10th day instead of 15th day. And I saw that rash was there. And he said, Doctor, this was the same rash which I got it when I had the typhoid. After that, when I was discharged from the hospital, this similar rash was there and it appeared. So it was a very good sign that patient is going in reverse direction. The urine has become normal. So I had asked him to check the urine routine, and urine routine, there was only 1+ protein was there in the urine. The RBCs, 1 or 2 RBCs in the urine routine examination, routine and microscopy. So it was good sign that patient has recovered from that state to this specific state. And after a month, when I checked his serum creatinine, the creatinine, which was nearly about 3.4 or 5, it has reduced to 2. And that was again a good sign. So patient was on the recovery and he was kept on placebo for longer time of duration. Generally, in such types of cases where the kidney is at fault, I never used to use the biochemical remedies. I used to keep those patients generally on constitutional, whatever may be the remedy. If it is acute ARF, then I used to use the L serum. If it is CRF, there is no role of L serum. And this patient was recovering in a very perfect manner. And within span of 3-4 months, he was absolutely came to the normal. That rash remained nearly about 10 to 15 days and gradually fade up. And he settled completely. So Terebinth is such a depacting remedy which brings out the patient out of this problem. The second case is of recent origin. Just yesterday, I had a third follow-up. And this fellow is again a same case of, this was a little bit older. He was nearly about 42 years, male, again having the same diagnosis, CRF, chronic renal failure, and his serum creatinine was nearly about 10, 1.5 months back. I took his whole case and he said there is a tremendous distension in abdomen. And it was really, he used to say, whatever I used to eat, there is a distension in the abdomen and there is a problem in passing the urine. And doctor has asked me to take only 1 liter of water per day. And very difficult to pass the urine, very scanty urine. Many times it contains the blood also. And they have advised me to go for dialysis, and they advised me to keep a donor so that we can go for kidney transplant also. So young fellow, nearly about 42 years of age, and this fellow had have such a problem. And there was a tremendous distension of abdomen. Looked like to be lycopodium, but not lycopodium. And then I checked him. There was a tremendous distension and there was noises in the abdomen. The peristalsis was noisy and the tympanic abdomen was there. And this was the report. Terebinth is also having this very characteristic, very typical characteristic of tympanic abdomen or meteorism. That is another thing. So I have started this fellow Terebinth again, few doses of Terebinth followed by the placebo, kept on placebo, asked him to meet me every 15 days. During first follow-up, after the 15 days, earlier his blood pressure was very high. It was nearly about 160 by 120 in the first consultation. When he came for follow-up after 15 days, he came with the report because he was suspicious about taking the homeopathic medicine. But still, he has done the report and it was found to be a 8.9. So we was happy that within 15 days, I got some result. Asked whether, have you checked it in the same lab? Then yes, he said yes. And he felt better even at abdominal level. His blood pressure has reduced. It was 160 by 120 around in first consultation. It has reduced to 145 by 105. So I have continued him again on the placebo, kept him on placebo. I asked again to come and meet me after 15 days. And then again, it was reduced. Creatinine was reduced. It was nearly about 8 in the second follow-up. And then blood pressure was again reduced. It was 140 by 100. And he was happy because the edema over the leg extremities has reduced. So same treatment, I have not repeated Terebinth. I was just keeping a watch whether he gets reversed or something happens. But no, there was no reverse and patient has recovered so nicely that yesterday when follow-up was there, it was 7.2. The creatinine was there. Blood urea was also reduced. His hypertension completely vanished. This time it was nearly about 90. 130 by 90. Then edema absolutely disappeared under the action of Terebinth. So it was very recent case. The first fellow who was a painter used to suffer, used to use the turpentine while removing the color, and even in they used to mix the turpentine in the colors, and that was the one important hint which I got, that the remedy prepared from turpentine is the Terebinth. So this is wonderful remedy one must learn from the Allen's notes. So Terebinth, oil of turpentine or volatile oil. The urine has odor of violets, very typical feature. First sentence itself defines the action is on urinary organ. This is one more feature which I missed to tell you in this case, that the tongue was clean as if varnished like a pyrogen. Tongue, the smooth glossy red as if deprived of papillae or as if glazed like pyrogen. Elevated papillae, coating peels off in patches, leaving bright red spots, or entire coating cleans off suddenly in exanthema. So it was looks like a very typical clean tongue, absolutely clean tongue. Dry and red, burning in the tip of the tongue. And here he has mentioned that compare it with the muriatic acid. Abdomen extremely sensitive to touch. So abdomen was quite sensitive to touch. Distension, the flatulence, excessive tympanitis, meteorism. Colchicum is one more remedy. Meteorism is nothing but the tympanitic abdomen, distended abdomen is the meteorism. Diarrhea, stools watery, greenish, mucus, frequent, profuse, fetid, bloody, burning in anus and rectum, fainting and exhaustion after the diarrhea, like arsenic alum. So GI features and GOT tract and GIT tract both are in very strongly affected in Terebinth. but more commonly the urinary complaints are more strong. Worms with foul breath, choking sensation over there like sena and spigeli. Worms with dry hacking cough. This is the state which has been mentioned over there. Dry hacking cough, tickling in anus, ascarides, lumbrici, tapeworms, segments past. So it is a very important worm remedy other than sena, other than spigelia. This is one more remedy one should not forget over there. One more is ticurium marum. Hematuria, where the blood is thoroughly mixed with the urine. Sediment, like hematuria like coffee grounds or sediment like coffee grounds. Hematuria where cloudy, smoky, albuminous urine is there. Hematuria with profuse urine, dark and black, penless urine. So this is very typical urine which you can get in such types of patient. It is scanty, it is bloody, it is coffee ground sediment, it turns dark. Congestion and inflammation of the viscera, the kidneys, the bladder, the lungs, the intestine, the uterus, with hemorrhage and malignant tendency. Malignant tendency. This is a very important remedy even for CA uterus. So malignancy, that's why I have said this is a remedy from cancer miasm. One must always keep it in your mind. Purpura hemorrhagica, that is very important. It is a hemorrhagic remedy. Fresh ecchymosis in great numbers from day to day, like sulfuric acid. Ascites with anasarca in organic lesions of the kidneys, dropsy after scarlatina. Dropsy after scarlatina. If your scarlet fever is suppressed and patient enters into dropsy, one should not forget this remedy. Very, very important remedy. Other than Apis, Helleborus, lachesis, these are remedies which we know. In Apis, thirstlessness is very, very marked over there. Helleborus, it is associated with brain complaints more commonly. Hemorrhages from the bowels with ulcerations, passive dark with ulceration and epithelial degeneration. It is one of the important remedy for ulcerative colitis also. Ulcerative colitis, the tympanic abdomen, very distended abdomen, this is one of the important remedy. Violent burning and drawing pains in the kidneys, bladder and urethra. So burning and drawing, specifically in the kidney, in the bladder, in the urethra, like Burbis vulgaris, Cantharis, then cannabis sativa. This is one more remedy which is very close to it. So these are the remedies where you can get similar types of features, but every remedy has their own characteristics. There is violent burning and drawing pains in kidneys, bladder, and urethra, violent burning and cutting in bladder. Tenesmus, this is the word which one should not forget. It is spasm. It goes into spasm while passing the urine. Sensitive hypogastrium. There is very severe pain in hypogastrium. Cystitis, that is the inflammation of the bladder and retention of the urine from atony of the fundus of the bladder. So it goes into spasm and bladder becomes atonic thereafter and patient is not able to pass the urine. This is the state of the Terebinth. So Terebinth, urinary complaints one should not forget. Albuminuria, urine contains albumin, pathological general. Acute in early stages when the blood and albumin above more than casts and epithelium. Albuminuria after diphtheria, after scarlatina and after typhoid. So these are the three important things after which you can get the albuminuria, either diphtheria, either scarlatina or after the typhoid. If the patient develops this albuminuria, one should not forget this terebinth. Urine is rich in albumin and blood. So this is again one more practical issue which you can look for. But few, if contains casts. Urine aggravated from living in damp dwellings. That is what I have told you in the case that damp dwellers always suffers from if suffers from albuminuria or renal disease, then think of Terebinth. If they suffers from rheumatism, then you think about the Rustox as an acute, or natrum sulph as a chronic, or Dulcamara as a subacute remedy. Strangury. Strangury is very strong spasm while passing the urine, spasmodic retention of urine. So when it goes into spasm, there is a retention of urine, and that is very, very characteristic. So clinically, if you think this remedy, it is a very good remedy in nephrotic syndrome, it is very good remedy in glomerulonephritis, it is very good remedy in medical renal disease or chronic kidney disease, along with cystitis, along with urinary complaints, along with hematuria, along with albuminuria, along with casts in the urine. And then if it is associated with distended abdomen, then this is 100% sure that this is Terebinth. Relationship, compare alumen, then arnica, arsenic, cantharis, lachesis, and nitric acid. It is recommended as a prophylactic in malarial and African fevers, that is Allen's hint as a prophylactic remedy for that. This remedy gets antidoted by phosphorus. Phosphorus is a good antidote for this remedy. This remedy antidotes phosphorus as well as murk. So this remedy is antidoted by phosphorus as well as it antidotes the phosphorus as well as murk. Remedies that precede smell, that is before the terebinth, murk is the remedy. Generally, this remedy 6 to 200 potency, that is the dose which has been suggested even in certain books. It should not be repeated too much. It is a very defecting remedy. And that's why you have to be very cautious unless and until symptoms recalls again. You should not repeat the remedy, or you should not go for even high potency immediately. So a remedy which is from cancer miasm, psychosyphilitic miasm, one must keep in mind for such types of clinical aspects. So that's all for today. Thank you being there. We are on concluding parts of the third year syllabus remedies. So that's all for today. Tomorrow we'll meet again with one more remedy. Good night.
Thank you very much, sir. Good night, sir.
Thank you, sir. Night.